Ever felt your heart pounding before a big presentation or an important meeting? This feeling, my friends, is what we call anxiety. It's that unsettling wave of worry that washes over you, the racing thoughts you can't seem to quiet. Anxiety in its simplest form is a natural response to stress. It's our body's way of saying, hey, brace yourself, we're about to face something challenging. But here's where things get tricky. When this feeling becomes a frequent visitor, when it starts to interfere with your daily life, it's no longer just a response to stress. It becomes a disorder. And it's important to know that everyone experiences anxiety differently. It's not a one-size-fits-all issue. Some of us may feel jittery and on edge, while others might find themselves trapped in a cycle of intrusive thoughts. You're not alone. Millions of people grapple with anxiety every day. But what exactly happens in our bodies when we're anxious? Well, let's dive into the fascinating world of neuroscience to find out. Anxiety isn't just a state of mind. It's a complex biological process that starts in the brain. When we perceive a threat, our brain leaps into action, activating the fight or flight response. This is our body's built-in survival mechanism, honed over millions of years of evolution. The amygdala, an almond-shaped structure deep inside the brain, acts as the control center for this response. It signals the hypothalamus, which in turn sends a distress signal to the rest of the body. This distress signal prompts the adrenal glands to release a surge of hormones, including adrenaline and cortisol. Adrenaline increases heart rate, blood pressure, and energy supplies, preparing the body for immediate action. Cortisol, on the other hand, curbs functions that would be non-essential in a fight or flight situation and enhances the body's ability to repair tissues. It also helps the body maintain a steady supply of glucose to the brain, ensuring it has the energy it needs to stay alert. These hormones cause the physical symptoms of anxiety. You might feel your heart pounding, your palms sweating, your breath quickening. You might feel a sense of dread, or feel like you can't think straight. This is all a normal part of the body's response to stress. But why do some people experience this response more intensely than others? Science suggests that genetics and environmental factors both play a role. Studies have found that people with certain genetic markers may be more prone to anxiety. Meanwhile, environmental factors like childhood trauma, stressful life events, or even chronic health conditions can also trigger anxiety. So anxiety isn't just about being too sensitive or overreacting. It's a complex interplay of brain chemistry, genetics, and life experiences. Understanding the science behind anxiety can help us manage it better. By recognizing that anxiety is a normal biological response, we can start to approach it with a little more compassion both for ourselves and for others. So, what does the latest research say about managing anxiety? Well, it's a vibrant field with a plethora of studies coming out each year. Let's dive into a few key findings that have been making waves recently. One of the most widely recognized strategies for managing anxiety is cognitive behavioral therapy, often abbreviated as CBT. It's a form of therapy that works on the premise that our thoughts, feelings, and behaviors are all interconnected. Essentially, by changing our thought patterns, we can alter our emotional response and behavior. Recent studies have shown that CBT can be incredibly effective in managing anxiety, with many individuals reporting significant reductions in their anxiety levels after undergoing this form of therapy. Next on the list is mindfulness. While it's been around for thousands of years, it's only recently that science has started to explore its impact on anxiety. The practice of mindfulness, which involves staying present and fully engaged with the moment at hand, has been shown to reduce anxiety by helping individuals let go of worrying thoughts. A study published in the Journal of Consulting and Clinical Psychology found that mindfulness-based therapy was as effective as medication for preventing relapse in recurrently depressed patients, a group known to have high anxiety levels. Speaking of medication, it's another approach backed by a wealth of research. Antidepressants, benzodiazepines, and beta blockers have all been used to treat anxiety disorders. However, it's important to note that while medication can be highly effective, it's not the right solution for everyone. Side effects, interactions with other drugs, and withdrawal symptoms are all factors to consider. What's crucial to understand here is that there isn't a one-size-fits-all approach to managing anxiety. Everyone is different, and what works for one person may not work for another. The effectiveness of strategies like CBT, mindfulness, and medication will depend on individual circumstances, personal preferences, and the specific type of anxiety disorder. That's why it's essential to work with a healthcare professional to develop an individualized treatment plan. It's all about finding a balance and discovering what works best for you. Remember, there's no one-size-fits-all solution. It's about finding what works best for you. So, where does all this leave us? Well, we've taken a deep dive into the world of anxiety, a condition that many of us face yet often struggle to understand. We've unraveled what anxiety is, a natural response to stress, something that's hardwired into our biology to help us navigate and survive in this complex world. But when it becomes more than a fleeting sensation, when it starts affecting our daily lives, it transforms into a disorder that needs our attention and care. We've explored the science behind it, understanding how our brain and body react when anxiety takes hold. We've learned that our amygdala, the fear center of our brain, and our autonomic nervous system are the key players in this intricate dance. They interact with each other, creating the physical symptoms we associate with anxiety, like a racing heart, quickened breath, and that unsettling feeling in the pit of our stomach. We've also shed light on the latest research on anxiety management. We've seen how cognitive behavioral therapy can help us reframe our thoughts, how mindfulness and meditation can bring us back to the present moment, and how physical activity can help us burn off some of that excessive nervous energy. We've discovered the role of medication, balancing the brain chemistry for those who need it, and the importance of a good support network, reminding us that we're not alone in our journey. And that's the crux of it all. You're not alone in this. Anxiety is a common issue that many of us grapple with. There is no shame in admitting you're struggling, and there's no weakness in seeking help. In fact, it's a sign of strength, a step towards reclaiming your life from the clutches of anxiety. So remember, it's okay to not be okay, but you don't have to stay that way. Reach out to a healthcare provider, a trusted friend, or a support group. Start that conversation, take that first step. Because there are ways to overcome anxiety, and it all starts with you. You're not alone in this, and there are ways to overcome anxiety. Don't hesitate to reach out for help. Remember, it's okay to not be okay, but you don't have to stay that way. Before we wrap up, we want to remind you once again that it's okay to not be okay. You're not alone in this battle against anxiety. There are many resources available, and it's important to remember that seeking help is a sign of strength, not weakness. Start by talking to someone you trust, or reach out to a healthcare provider. Join a support group, engage in activities that help reduce your anxiety, and remember, every step you take towards managing your anxiety is a step towards reclaiming your life. If you found this video helpful, please don't hesitate to hit the like button, share it with someone who might benefit from it, and subscribe to our channel for more content like this. We're in this together, and we're here to support you every step of the way. Thank you for watching, and remember, you're not alone in this journey.